supplements and vitamins are supposed to complement for the ones or the things that are deficient in our diet, not to replace them completely. But you see, some people will buy supplements because they are taking vitamins. They will not eat properly. They will not eat well. Why some do not even take vitamins at all because they believe that everything they need is in the food they are eating. And sometimes that's your diet is not dieting. Well, we're talking about vitamins and vitamin deficiency in today's episode of Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. My name is Amazing Rita, and I'm in the studio with Dr. Dimba Favor. Dr. Favor, how are you doing?
Very fine.
Did you take your vitamins today? Did you take your supplements today?
What do you want me to
Bring
say
your
now?
glasses down when you answer me. Okay, so what are vitamins and why is it important to the human body?
Vitamins are just a class of food and they contribute to our body's immunity and well-being generally. It's just an important class of food.
So why is it that the human body cannot produce some vitamins on their own?
The human body cannot produce some vitamins on their own because God made it that way. It's not something we can change. However,
I wanted to say
there's
something,
some.
but it's going to cause another problem. But let's leave
What's
it.
that?
I wanted to tell you that, but everything God made was good. How would you say, my opponent? How would you say that? Okay, but let's leave it like that.
All right. Yes, everything God made, He made it good and wonderful. Then the fact that He didn't create us with the ability to produce
Some
all vitamins. However, we can't produce some. It still means that
There's a balance.
there's a balance because He still created those things from
That
which we
can-
can get
yes.
those ones the body cannot produce.
Preach. Okay.
Yeah, and then some of these vitamins, like the body actually produces them, but then we term it as example vitamin B12. The body produces vitamin B12, but we consider it as one of the vitamins the body does not
Not produce.
produce. The reason is this: in the gastrointestinal tract, when you come to the from the stomach, the food goes. It takes a downward movement. That's a from head to toe movement, like it's
Yes.
going down,
Down.
not coming upward. So imagine a situation where vitamin B12, I'm just giving an instance, vitamin B12 is supposed to be absorbed in this region and then it is produced here. Can you just picture it in your mind? Like vitamin B12 is produced, I'm assuming now it is to be absorbed in this region. It is now produced here. So normally vitamin B12 is absorbed in the ileum. But the point of production of vitamin B12 is distal, that's below that part where it is absorbed.
Yeah.
And remember I said during digestion, it's a downward movement from up to down, not down to up. So when this vitamin B12 is finally produced, where it is produced, it cannot start coming up to the point of absorption. Do you understand? So in that instance, we call it one of the vitamins that is not produced in the body,
yes.
because it is produced but distal to the point of absorption.
Okay.
Yes.
So, Dr. Famous, tell us, what are the major categories of vitamins?
Okay. We have fat-soluble vitamins and water-soluble vitamins.
Okay.
Fat-soluble vitamins, we have the vitamin A, vitamin D, vitamin E, and vitamin K. We call it ADEC.
Okay.
While all the B vitamins, they are all water soluble. Vitamin B1, B2, we don't have
B3.
We have B3.
Okay.
Vitamin B1, B2, B3, we don't have B4. We have B5,
It's B6.
we have B6, we have B7, we have B9, we have B12. All of them, they are all water soluble vitamins. So what the differences between these fat soluble and water soluble vitamins fat soluble vitamins, just like the name, it requires bile emulsification to be able to be dissolved. It requires pancreatic secretion, and then it requires an intact ion to be dissolved. While water soluble vitamins, they don't require any fat emulsification. Then fat soluble vitamins are usually stored in the body, but water soluble vitamins are rarely stored in the body, except include your vitamin C to your water soluble
Okay.
vitamins, yes, except the vitamin B12 and
Okay.
B9. They can be stored in the body, but vitamin B9 is stored for a very short
Short
duration, usually 3 to 4 months, while vitamin B12 can be stored for up to 3 to 4 years. But the other water soluble vitamins, they
Cannot
can't be
store.
stored in the body. Yes, so these are some differences between the fat soluble and water soluble vitamins.
So, what are the things, we see lifestyle factors that make some of these vitamins deficient in our body?
Things like, some people they call vegetarians. Yes, these vegetarians, they have strict vegans, and then those who are not full vegetarians. So some of these vitamins are obtained from animal sources, while some are obtained from both plants and animal sources. So for those ones obtained strictly from animal sources, vegans will be deficient in them. So vegetarians are at risk of vitamin deficiencies. Then our diet, some people don't eat proper diet. So when they don't eat proper diet, they are lacking in some of these vitamins. Another thing is some people have some congenital issues. Like there's what we call the Hartnup disease. Hartnup disease, there's a receptor in the kidney that is to reabsorb proteins. Yes, and then these proteins, there is one of it, tryptophan, that is transformed or changed into serotonin and vitamin B3. So in a person who is having this Hartnup disease, the person don't have that receptor that will reabsorb this protein. So that tryptophan is a protein. So when that tryptophan is one of the proteins, so when tryptophan is not available, there will be no precursor for production of serotonin and vitamin B3. That's niacin. So this person will be deficient in vitamin B3.
Yeah.
There are some people who have kidney issues, chronic kidney diseases. These people with chronic kidney diseases, they will not be able to reabsorb proteins. Some people who have chronic liver diseases, you remember I said for fat soluble vitamins you need bile emulsification as one of the things required for its absorption. So someone having chronic liver disease, bile emulsification you cannot have absorption of fat soluble vitamins. Another thing is people having maybe somebody that has had a gastrectomy or just a surgery that's affected the terminal ileum. That's where some of these vitamins are reabsorbed.
Okay.
Yes. So if that part of the intestine is affected, the vitamins cannot be reabsorbed. So these are some reasons why some people can come down with deficiency of vitamins.
So tell us, what are some of the effects of lacking some of these vital vitamins?
There are so many effects, so many. Okay, let me see if I can start from the head to the toe.
Okay.
Yes. There could be alopecia, like deficiency of vitamin B5 and vitamin B7. They can cause alopecia. There could be affectation of the eye, night blindness. There could be what we call bitter spot. That one is from deficiency of vitamin A.
Okay.
We also have dermatitis. Dermatitis is like skin affectation. This one could happen both from deficiency of vitamin B5, vitamin B7, and even deficiency of vitamin B3. For vitamin B3, we have what we call pellagra. Pellagra is a condition that comprises of three things. They call them the 3Ds. Some people include the fourth D. There's dermatitis. Dermatitis, that's the skin affectation I'm talking about. Dementia, the person starts forgetting things. Diarrhea, the person starts having loose stool, and then it could lead to death. So these are the 4Ds of pellagra. Pellagra is seen in vitamin B3 deficiency. Other things that can occur from vitamin deficiency, it can affect It can cause macrocytic anemia. Macrocytic anemia, that's from deficiency of vitamin B12 and vitamin B9. It can affect the nerves, the neurons. It can affect balance, especially for vitamin B12.
Mm.
So there are so many adverse effects of vitamin deficiencies.
Oh.
Mm-hmm.
That's huge. So, what vitamin could be lacking when someone is finding it difficult for their wound to heal, or probably the immune system is breaking down?
Okay.
Some people may
Yes.
think it's just maybe match poison, or your village people have decided to remember you.
Yeah.
But I believe there should be something deficient in the body for the body not to be able to regenerate and heal up that
An
wound.
injury.
Mm.
Most times, more of vitamin C.
Okay.
Mm-hmm. Vitamin C is important for reepithelialization,
Mm.
like reformation of the epithelial lining and
Mm.
epithelial cells. Vitamin C is very important. It's a very important factor for wound healing.
Mm.
So people who are deficient in vitamin C, they could have difficulty in wound healing.
Mm.
Mm-hmm.
Okay. And then who are the people that are at risk of vitamin deficiency the most? Women, men, children.
Vitamin deficiencies, it does not have any particular population or age group it targets.
Mm.
Everybody could be at risk of vitamin deficiency.
Mm.
Remember, even if we're trying to look at women, male, babies, children,
Mm.
someone who is a vegan can be a male, can be a female.
Mm.
So it's not targeted towards any sex
Yes.
particularly.
Mm.
It can affect anybody at all. A male can decide not to feed well, he'll come down with vitamin deficiency. A female can decide not to feed well, she'll come down with vitamin deficiency.
Can excessive consumption of alcohol lead to deficiency of some of these vitamins in the body?
Yes. Excessive consumption of alcohol can. How can it? It can affect the liver. Remember our previous series on liver cirrhosis?
Mm.
Yes, excessive alcohol can damage the liver, and then it will be difficult for fat soluble vitamins to be absorbed, because I told you there are three components that are required to be intact for fat soluble vitamins to be absorbed. Then secondly, excessive alcohol can cause inflammation. Imagine if the terminal ileum is inflamed, all the vitamins that are supposed to be reabsorbed in that area, they won't be reabsorbed. So these are some ways excessive alcohol consumption can limit or cause can cause vitamin deficiencies or limit the absorption of vitamins.
Okay, for a pregnant woman, how can vitamin deficiency affect she and the unborn child?
In our last episode, we discussed about importance of antenatal care and something like that. But in that episode, we talked about a woman being deficient in folic acid. Folic acid is vitamin B9.
Okay.
So imagine a pregnant woman having vitamin B9 deficiency. That child will definitely come down with neural tube defects.
Okay.
So vitamin deficiency can affect the unborn child. It can equally affect the mother. Exactly.
So how can are there some blood tests? Are there some symptoms, signs that doctors can see, then diagnose that this person has vitamin deficiency, and what vitamin is deficient?
Yes, there are. Just like I said earlier, the vitamin B3 deficiency, the patient can come down with what is called pellagra. Pellagra, you can easily, is most times a clinical diagnosis. When the person comes, you're seeing the skin rash, the dermatitis, and most times that rash that comes with vitamin B3 deficiency is usually around sun exposed areas. They call this one the collar necklace, because the rash usually occurs at the collar, the hand. So you'll see the rash. The person will tell you he's having diarrhea. The person will tell you he's no longer remembering things easily. And you'll see that this person is going down. This will be tilting you towards, this will be giving you an idea. This could be from vitamin B3 deficiency. You could see someone with angular chelosis. You see some sores or cracks in the mouth, in the gums. This could tell you there's deficiency of vitamin B2. For vitamin
So that thing we usually used to notice by the side of our mouth that used to call malaria symptom.
Not all of them.
Okay, not all of them.
Yes, angular chelosis, it could be by the side of the mouth, but that does not always mean it's from vitamin deficiency. Some could be in the
Gum.
mucosa.
Okay, the
The
mucosa.
mucosa, this signifying vitamin B2 deficiency. And sometimes, if you notice, when some people have some of these sores in their mouth, they just tell them you should place a vitamin C there or take oranges and it will get better. Remember, we said vitamin C is for reepithelialization. There's some other things you can, for the vitamin B1, vitamin B1 is a cofactor for different metabolic processes in the body. So there's actually an investigation, a test to do. You want to check the red blood cell transcatolase if it is reduced or if it is normal to tell you if there's vitamin B1 deficiency. When you also do your full blood count, you want to check if this patient is having megaloblastic anemia. If the patient is having megaloblastic anemia, it will give you a sign that there could be vitamin B9 or B12 deficiency.
Okay.
Yes.
Okay. Now, when you notice that there is a vitamin deficiency,
Okay.
is vitamin injection, example like the B12, does it work faster to cover up for that deficiency than oral supplements?
All right. For vitamin injections, it's not all vitamins that have injections.
Yeah.
But then the ones that have injections, they actually act faster than the per oral supplements. Just because some of them are going directly through the blood vessels, that's the intravenous ones, or some are being injected into the muscles. So they actually have a faster action than oral.
Then for somebody that's probably is used to taking vitamins, because it's not a thing really. Yes, people are not buying supplements and vitamins just because they see one fancy advert and they'll be like, every woman. So can there be a situation where you have an overload of vitamin?
That's what we call vitamin toxicity. This is when the vitamin is now more than it should be. I don't know if you've come across this post. There's a particular doctor that gives wellness posts online. So she wrote about a woman who came to the hospital, and then she was diagnosed of kidney issues. They managed her, did everything they could. She got better at some point and later relapsed. And when they finally asked, she finally told them there's something she has been taking. When they looked at it, it was vitamin A supplement. She had vitamin A toxicity. You know, vitamin A, one of the functions is to help with acne. So some people actually want a clean, glowing, neat skin, and then they start to abuse these vitamins. Vitamin toxicity is real, and it has so many adverse or side effects.
Tell us about the side effects.
Okay, like I said, it could affect the organs in the body.
Wow.
Like this scenario I just gave you of the patients that they were managing for kidney issues, but they were not seeing anything
The reason
until she finally told them that there's something she has been taking. And when they looked at the component, it was retinol, vitamin A. And then this vitamin A, retinol, they can use it in treatment of acne. But like I said, some people abuse it, and it is teratogenic. Teratogenic in the sense that it is harmful to fetus, children in the babies in the womb. It is very harmful to them. Very, very harmful. The child can come out with a lot of abnormalities. Some of them can equally affect the nerves, in as much as vitamin B12 can help. If it's deficient, there will be nerve deficiency, there will be nerve defect. Some of them, in their toxicity, they can affect the nerves. So these are some things some vitamin toxicity can cause.
What is now advisable to do? Is it for you to go for checkup and your doctor would recommend, or for you to pick any vitamin you see and take it in moderate quantity?
Everything is about moderation. Yes. You yourself, you would know when you're abusing something. You don't even need the doctor to tell you you're abusing this thing. You would know. Just like this patient now, on her own, she decided to speak up and tell them there's something I've been taking. Imagine someone that takes vitamin A daily, every day, and has done this consecutively for the past 2 years. That will lead to toxicity. Yes. So we should just do things in moderation. Eat right, drink a lot of water, stay healthy.
So, as parents, what
Okay.
can they do to ensure that their infants, children, they get the proper vitamin, like they get the necessary vitamins that
They
they need,
alright.
and then make sure that they are not deficient in any vitamin.
Vitamin. Okay. What they can do, like I said, nutrition is very, very important. Not just maybe some people feel um my child is selective, like some babies they can be selective with food, but there's a way to go about it. Like mothers who are converting from exclusive breastfeeding,
So
you now
formula.
want the child to now start having family feeds, formula and everything. The counseling we give the parents, when you in the child's pap, you can dissolve the egg yolk, you can put the crayfish, you can put everything inside and then make the pap, and that way the child is getting everything adequately. Yes, so it's just to ensure they are eating well, eating right, and then the early morning sunlight, we know is a source of vitamin D,
D.
so we can expose them to early morning sunlight. This way we are trying to keep up with the adequate and appropriate thing.
Okay, so what's your advice as a wrap up? What's your advice for our listeners as a concerns vitamin, and how the way they use their approach to managing their the deficient vitamin in their system?
All right. Everything I want to say will just be summed up in one sentence. We should make sure we eat healthy. Yes, healthy diet. Like I said, some of these vitamins they are gotten from both plant and animal sources, while some are just gotten from animal sources. And even the vegans who are strictly vegetarians, they can get these supplements externally. The ones they know they are lacking in their diet. For example, vegans are at risk of vitamin vitamin B12, vitamin D, but this vitamin D is not just for vegans. Majority of people are at risk of vitamin D deficiency. But for vegans, vitamin B12, vitamin D, calcium, these are some things they are at risk of lacking. So appropriate diet, the right diet, when you eat right, you're sure that you're almost not missing anything. And then eating right is also helping your immunity, because vitamins are a major component of our immune health.
Okay, thank you so much, Dr. Favor.
Thank you.
And that's all we can take today on vitamin and vitamin deficiency. So it's not about buying all the vitamins that you've seen online that somebody's advertising or something. Sometimes buying them and taking them appropriately. But sometimes some of the things you take, you might not even need it because of the kind of food you are eating.
Eat, exactly.
So when you take it and you eat it, it sometimes becomes
excess.
so please, you should consult with your doctor that I'm taking this. And then if you notice that something is wrong, don't keep on taking what you're taking. Take that into the doctor and tell the doctor, okay, this is what I've been taking for like 1 month, 2 months, and this is what I've noticed. There could be a reason why it's affecting. Your body always gives you sign before it decides to collapse, because it's you that is not listening to it.
Yeah.
So until we come your way again, this is Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. We just discussed about vitamins and vitamin deficiency. And my name is Amazing Rita.
I'm Dr. Dimba Favor.
So do well to watch our previous videos. We have videos that we've talked about a lot of things, like a lot of things that you would actually learn 1 or 2 things from. Until we come your way again, do not forget to like, share, subscribe, and tell a friend to tell a friend that we just dropped a vital information on vitamins. It's bye from us.
Bye.